you. I'm Dr. Margaret Flowers, and I am a pediatrician, and I serve as a Congressional Fellow for Physicians for a National Health Program. And so I arrived here at the U.S. Social Forum on Tuesday in time for the parade with thousands of people, and it's been a really overwhelming experience, but fantastic, meeting really great people, and I think that the energy is really high here, that people are realizing what we're up against as a nation and as a planet, but really trying to come together and find ways to address these issues. So that's really, important, inspiring.
And I'm Katie Robbins, the national organizer with Healthcare Now, and we advocate for single-payer national health care, specifically HR 676. Being here at the Social Forum at this point in time, after the new health law passed, which essentially institutionalizes private health insurance in our country in a way that is unprecedented, it's inspiring to be having conversations with people who are familiar with our issue or not, and what I see as a high understanding and high consciousness of the fact that our healthcare system is still broken. Well, single-payer financing is really just a piece of the battle for the human right to health and health care. So we advocate for public financing. We're never going to get to a universal system where we can use the financial and other resources wisely enough to provide high-quality health care for everyone unless it's publicly funded and transparent, and we need to eliminate the bureaucracy, waste, and greed of the for-profit health insurance system to achieve that.
The United States ranks #1 in only one area in terms of healthcare, and that's how much we spend. We're spending 2 to 3 times more per person than the other advanced nations. But in comparison, our health outcomes are very poor. We're ranked 37th overall.
We have just passed a new health law that essentially mandates people who aren't eligible for public programs, Medicare or Medicaid, to purchase private health insurance. And the regulations on insurance companies, despite what is being sold from the Democrats and a lot of media outlets, it's like tissue paper handcuffs on the insurance industries. The pharmaceutical companies have done very well in this deal, and really it's the patients and people who pay taxes in this country who are going to suffer under the new law.
So it's really important that we not wait and sit back and question whether this legislation is going to be effective or not, because the legislation is not going to roll out immediately. It's going to be, over 4, 7, 9 years. We need to continue this work now, because these poor outcomes, these preventable deaths, the suffering is going to continue.
The Commission is basically meeting behind closed doors. They have one public forum every month, and they're going to make a recommendation on by December 1 of this year.
It's not likely that we'll be able to influence the recommendations of the Deficit Commission, but it is important to counter their misinformation.
Simultaneously, there's a billionaire, Wall Street billionaire Pete Peterson, who's been gunning for Social Security for decades, and he's funding staff to the Deficit Commission, and in addition, a private company called AmericaSpeaks to go out and perform what they call 21st century town hall meetings around the country, and they are generating materials that are full of misinformation. There's also apparently they're happening in 20 cities, or maybe even more from some folks that I heard talking about it earlier, that they are advertising 20 cities, but the events are happening in many other places. And essentially this is like this sort of, it's not a public town hall meeting when it's organized by a private company, okay, first of all. And then in addition to that, they're going to be able to produce data that supports the Fiscal Deficit Commission's positions on cutting these important social programs.
We have studies that in our population, we know that health disparities are growing in the populations under 65, but when you reach 65 and you get Medicare, our data shows that those health disparities start to disappear, because suddenly everybody has access to the same level of health care. So Medicare has made a tremendous impact on our nation's health, and we need to strengthen and preserve it. And we're telling our Congress members that not only are we asking you to not make cuts to Medicare, but that the best way to actually strengthen Medicare is to improve it and extend it to our whole population, because we know that again, it comes down to, how do we spend our money? Right now we have so many different insurance companies that our money, healthcare money, is divided up. If we put it all into a single public fund, a Medicare for All fund, we know that we have enough already in this country to provide comprehensive, high-quality care to every person.